Today, I wanted to share some information with you as to why physiotherapists prescribe home exercises. Sometimes it can be a bone of contention that people feel if they're paying for care that the physiotherapist or whoever the healthcare provider is should do all of the work. And that while that might be a view, home exercises are usually prescribed to minimize the amount of one-on-one contacts that patients need with the therapist. So the therapist does an assessment, determines what specific deficits are causing the patient's problems, and then prescribes exercises to facilitate whatever treatment techniques have been done as part of the in-house care plan. And that may be flexibility related exercises, or it may be excuse me, or it may be exercise to strengthen weakened muscles, or more types of exercise to correct postural alignments or try to improve functional movement patterns. So there's a spectrum of different kinds of exercises, all which do different things and are prescribed for particular reasons. And that's generally what any skilled therapist will utilize when they're trying to prescribe a home exercise. So although you could certainly YouTube home exercise programs for back pain or neck pain, the question is really, are they specific to what your requirements are, or do you need? Are you spending time doing things that are erroneous and not particularly focused on trying to solve the issue? So the purpose of a skill assessment is to determine the underlying mechanism of what's wrong, and if that's a flexibility related issue, then your exercises need to be flexibility focused, and if it's a strength related issue, they need to be strength focused, and the two things are two different things. If your issues relate to balance, control, coordination, again, specific kind of corrective exercises need to be put in place to enhance those components. It's a bit like comparing a weightlifter to a marathon runner. There, you could describe them as both fit individuals, but very fit in different ways and very different capacities. So likewise, that same applies to just our general functional capacity. We need certain components of flexibility and strength and control and coordination to be able to do the things we want to do in daily living. So the reason physiotherapists prescribe home exercises, as I say, is to minimize the one-on-one contact time. That's one reason. The second is that unless you're having daily supervised sessions or 2 to 3 times a week, which wouldn't be that common unless you're in a professional sports environment, to produce a training effect, you need to be doing things with a certain frequency. If you went to the gym once a week, you'd be very, very slow gaining any strength. Maybe not. That wouldn't be as specific in terms of flexibility, because you would definitely get some flexibility. But obviously, if you're doing something in a more structured, systematic way, you have a much better chance of having a quicker response and therefore less downtime, and be able to return to your chosen activities. So it's often a bone of contention might be the wrong word, but often patients will come back and say, "Oh, I didn't do my exercises," and sort of feel guilty, and and sometimes people would reprimand them for not doing them. It's just a simple issue of prioritization, really, and I tend at this stage of my career not to. There's no point in castigating patients and feeding into their guilt. It just means it's a little bit slower to get to the end point, and as long as that's perfectly transparent and made aware of it, then people are aware of what the cost benefit analysis is. But I suppose the deeper question is, if people aren't complying with home exercise home exercise prescriptions, should I say, is it because they don't see any practical benefit from it? If you don't really see a practical benefit from it, well then it's quite understandable that you wouldn't be spending much time doing it. And as a therapist, we would have to seriously question whether our prescription is wide of the mark. Is it actually doing something useful, or is it really just filling people's time without being particularly effective in leading people where they need to be? So that would be an obvious question. The other is really what people's motivations are. Are they keen and enthusiastic about getting back to full function if they're compromised, or back playing sport, or is it sort of a, well, be nice thing to do, but there's no mad rush. So you can get a gauge of people's desire and hunger to try to speed the process up by their commitment to home exercise. Sometimes people just are too busy and too tired to focus on their own care, and often looking after other people's cares and needs and things like that, and they just slip down the priority list. So one shouldn't be judgmental about non-compliance with home exercise, but it's good. I think it's good just to discuss the purposes behind it and why they're prescribed by physiotherapists and other healthcare providers, and it's really with your interests at heart. But the key issue is that you need to feel some practical benefit from doing them. Otherwise, you're being a busy fool doing lots of things with good intentions, but not necessarily achieving things. And of course, with the massive amount of information available online today, the question really is: are you doing the things that are most specific to your issue? You'll find any amount of things to be doing, but if you're doing the wrong things, then obviously it's not really going to move you to where you need to be. So just thought I'd share that little bit of background information about home exercises, about why we as physiotherapists use them, and really it's with a view to just trying to optimize the care pathway. I'll see you again in another video. Bye for now.